Hi, and welcome to the Breastfeeding Medicine Podcast. I'm your co-host, Dr. Ann Eglash. I'm a clinical professor in the Department of Family Medicine at the University of Wisconsin School of Medicine and Public Health and a board-certified lactation consultant. This podcast is produced and edited by the Milk Mob and is co-sponsored by the Academy of Breastfeeding Medicine. Are you ready to go? Hey everyone, this is Ann on podcast series, and I'm talking today with Elizabeth Bayne, who is the producer and director of a movie that's in production called Chocolate Milk. Hey Elizabeth, how are you?
Hi, Ann. I'm good, thank you. How are you doing?
Good. Thanks for joining me on this podcast, and I'm really excited to hear about this movie that you're producing. And so first, can you tell us what the movie is about?
Yes, and thank you for having me on the show. I'm excited to tell you what it's about. It's a documentary that's focused on the disparities in breastfeeding among African American women. Um, and so instead of solely focusing on the benefits of breastfeeding, we're looking at some of the challenges that this particular segment of the population in the United States experiences when they decide they want to breastfeed. What are some of the barriers that they might come up against?
Mm-hmm. Right. So what led you to do the movie?
That is an interesting story. I am not a mother. I do not have any children. I have never breastfed. I am a public health advocate. My background's in public health, and I went to film school to make media content around public health issues. That being said, I had graduated and I was working, but I hadn't really been using the skill sets that I developed in film school for public health. But I'd always been a member of the American Public Health Association, still get the journal, still get the newspaper, This Nation's Health. And on the front cover one day, I saw an article about uh, Black women lagging behind in breastfeeding. And at this point, I was not even aware that breastfeeding was a challenge in America for any demographic in general. And when I read that not only was breastfeeding a challenge for most women in the United States, but that Black women were lagging behind and had been so for at least 20 years, it caught my interest
Yeah.
because, yeah, it's an interesting. It seemed really obvious for someone who's not a mom and outside of that realm. It just seems like, well, we're mammals.
Right.
Uh,
Exactly. Like, how did we get here? Exactly. Yeah.
Yeah, and so to find out how we got here, I did this kind of deep dive into literature and was really astounded with what I found.
Hmm. So, would you say when you say you took that you're taking a deep dive in the literature, are you bringing in a historical perspective as to how this has happened over the years with the disparities, or are you looking more at, or in combination with, what's actually happening right now with the current challenges and current cultural, um, yeah, I guess cultural challenges.
Now, that's a really good question, Anne, because I'm always have been a proponent of looking at the source of the problem,
Hmm.
because how can you address it unless you know what caused it?
Right.
And so initially I was just looking at the research literature to see, is this actually a statistical issue? Like, there's actually statistical evidence saying that more women of one group breastfeed than the other group? And then I started looking into why is this? And it is, as you indicate, a mix of historical factors as well as current economic factors and social factors. And it's this confluence of different things that create this complex web and trying to pull those pieces apart to figure out, well, why do Black women breastfeed at lower rates? Because they are breastfeeding, but why are we seeing that gap? And so, yes, there a lot of individuals in the Black breastfeeding community who really like to start with slavery and the legacy of that, and that brings you to wet nursing, and then so on and so forth.
Hmm.
Um, what? Go ahead.
Yeah, that's such an interesting topic. I think that, well, so I've been involved in breastfeeding medicine since the early 90s, and some people will
Thank
ask
you.
me, why, why do African American women breastfeed, have lower rates of breastfeeding? And I'm going to love seeing your movie because it's easy for me to reach into that history that is something that is told through sort of like storytelling in a way. Like, well, I think it goes back to slave times and wet nursing, but I didn't know for sure. And so I'm always careful about saying that because I don't want there to be a myth. So it'll be great to actually have data and,
Yes.
to have this documented that this is really the story that we need to understand.
And I'm looking forward to really vetting that because it has become somewhat of folklore or a myth.
Right, right,
And there's some issues with that theory because formula was not invented until the Industrial Revolution,
right, right,
which means that women of all races were still breastfeeding up until that point. And
right,
so slavery definitely precedes that period. Um, but the reason why it's still a factor is because of how it relates in terms of reproductive justice
mm,
for Black women, where we did not necessarily have complete autonomy over our own reproductive functions,
uh-huh, uh-huh,
and also how the value of our reproductive abilities. At one point, we did not get to decide when we wanted to have babies. It was decided for us, and there was some monetary value in that in larger society for Black slaves to reproduce. And then you see a flip of that in this, in the 40s to the 60s, where now that we're free, independent people, but we need resources from society,
mm-hmm.
now that reproductive ability is being curtailed, and it's actually the reverse. And so
Interesting.
that plays into the larger reproductive justice issue more so than I think breastfeeding specifically, because actually Black women were breastfeeding um, through the Industrial Revolution after the advent of formula because we couldn't afford it more
Right.
often than not. And we also had a legacy of midwives where we were having home births and still very much in control of our reproductive functions and choices up until maybe the 50s and the 60s when midwives became discredited in a certain way or kind of legislated against, and women were forced into hospitals to do all those things that we did on our own.
Right,
So
right,
it's a little bit more complicated than just wet nursing.
right.
Um,
Yeah, that's really interesting about the about midwifery because I know that there were some wealthy women that would birth early in the hospitals, but it was also poor women, poor white women who birthed in hospitals because they couldn't afford midwives, like in their 20s and 30s, and that's when physicians started to get involved in birthing. Whereas it used to always be midwives who birthed and midwives who were involved in infant care and breastfeeding in the early 1900s, and it was more like in the 40s where it became sort of common for at least Caucasians in this country to give birth in a hospital. But it sounds like the African American population wasn't part of that until later, that they continued to they were more likely to have midwives, is what you're
and
saying.
then, and another interesting fact is that even for white women who were giving birth, they were a Black midwife was attending their birth
Oh,
because
interesting.
most women were actually still having home births, but most midwives were Black at a certain point.
Hmm.
And then there was a shift where the hospital system wanted to have a little bit more oversight. Um,
Right.
so I'm looking forward to getting some academics who specialize in this issue to get them on camera and get a clear picture of what that scenario was, because a lot of times you're getting anecdotal information, and so I'm really looking forward to speaking with an expert and getting that story on camera.
Yeah, yeah. I think there is a lot of information that's been documented about that whole birthing history.
Yes,
Yeah.
yes, there's a Black midwife documentary. I don't want to butcher the name, so I'm not going to say it,
Okay.
but there is definitely one that exists. So there's been some work done on it, and I want to weave it in without losing the audience, where they might be like, we're talking about breastfeeding, but it's really hard to separate breastfeeding from the birthing process because
Oh, yeah.
so much of how you give birth will determine how successful you will be with uh, sustaining adopting breastfeeding. So
Right. Oh,
it's hard.
yes.
Yeah.
Yeah, if you look at the history of breastfeeding, as soon as women hit the hospital and began birthing in hospitals, that's when babies became separated from the mothers, and that's when
Mm-hmm.
physicians wanted the scientific method in terms of caring for babies and decided that they knew what was in formula, and it just totally destroyed breastfeeding, which is why the baby-friendly hospital movement initiative began recognizing, hey, we need to start all over again and look at support in hospitals at the time of birthing. Yeah,
Exactly.
right.
Exactly. The first film that really inspired me on this subject was actually The Business of Being Born.
Oh, that's a great
When,
movie. Yeah.
yeah, it's a great movie. And it was the first time I'd really been introduced to the idea that, or the concept that the way that we give birth in hospitals is disruptive to the natural process and release of hormones and different things that would actually facilitate birth and breastfeeding.
Right.
And I remember watching that when I was a much younger filmmaker and being very angry. I was like, what?
Right.
Um, so, so,
Yes.
so I, yeah, so I'm excited to have an opportunity to contribute to that pool of films that explore that issue because I think they're things we just kind of take for granted um, in our daily lives, not really realizing how a system is kind of forcing certain choices.
Absolutely. Yes. I think many of us are recognizing that in the hospital setting, and in fact, it's a major topic of conversation that I have with my patients when I see them in the lactation clinic about what had happened and why they ended up with the nipple shield and why they ended up why the baby got a bottle of formula after birth, and they felt this total lack of control. Like, this is not what I wanted. Why is this happening to me? Why is this happening to my baby? So it's still, even in baby-friendly hospitals, it still happens, unfortunately.
Yeah, and what have you found is the common factor there?
It's often, I think a lot of it is not trusting the mother and the baby to for this whole system to work. Like, for example,
Mm,
worrying about blood sugars being too low when if we just kept that baby at skin to skin and just allow that baby to have unfeathered access to the breast, and helping mom express some colostrum and giving that baby some colostrum on a spoon, just preventing this whole ordeal of the baby being separated, being cold, dropping the blood sugar. There's a lot of things that we can do with birthing that goes even beyond baby friendly to help to prevent these situations that would help to reduce those barriers to breastfeeding even further than what we're doing right now with baby friendly. Um,
definitely.
yeah.
And yeah, go ahead, go ahead.
Oh no, go ahead. I have another
I
question
was
for you.
just okay. Well, it just what you were talking about makes me think about this whole push now. What they recommend for women is being equipped to advocate for themselves or having a member of their birthing team being equipped to advocate because, like you said, a mom will go in expecting a certain experience and she walks away with a different one. And she might know what she wants, but maybe the staff isn't familiar. And
Right.
so she's got to be a little bit more, I'm trying to find the friendly word for it, but a little bit more assertive
Right.
or adamant about, well, I know this is how maybe you usually do it, but I really want to try it this way because it is sometimes it's the lack of confidence of the staff for the mother, but sometimes the mother needs to have more confidence, I think, in asserting her
Right,
choice,
right. It's
which
hard,
is easy to say. It's
it's
easy to say.
so much easier to say, yeah, because it's so intimidating. You're on someone else's turf and you're not feeling well and you're scared and you want to trust the healthcare staff that they know what they're doing, that
Hmm.
they're going to give you the best of care, but it's not in your birthing plan. And I would say that in medicine, when women do birthing plans, oftentimes physicians and hospital staff will kind of roll their eyes and go, yeah, well, that's pie in the sky. That's like you can't
Yeah.
predict what's going to happen. And so, yeah, but I agree with you. We do need to empower moms. And I think I think having a doula and having a midwife and having people around her partner, whoever that is, um, needs to be on her team, and her team needs to advocate for her so that she can just focus on her health at that point, get some,
Yes, yes, because
yeah.
the first mother that I followed on my documentary, she had a very harrowing experience, and you from what I understand, you're just kind of like scared the whole time. So you're
Yeah,
just trying to focus on your breathing and staying calm, and
right.
yeah,
Which
as opposed
is
to having to have a philosophical argument with the staff member.
Exactly. And it doesn't help. It doesn't help the progress of labor to become angry and stressed. We
Right.
really, if you look at like some of the homeopathic meds and other meds that we use to help encourage labor, they're often about relaxing, like giving, women epidurals to reduce pain and sleeping pills and things like that. Just kind of chilling out her adrenaline system seems to help. Um, so what are you hoping would be the outcome of this movie?
What I'm hoping will be the outcome of this film is that I think people are aware of the value of breastfeeding, but what I'd like to do is bring people's attention to the idea that it's not as simple as just understanding the importance of breastfeeding, but it's also important to be prepared for what to expect.
Hmm. Yeah.
Not and that preparation starts before you give birth. You can't start thinking about breastfeeding after the child is there, just because you're going to hit so many roadblocks, whether it's how you gave birth, where you gave birth, then it's when you go home, who are the family members and what is their knowledge and familiarity with breastfeeding. And then when you go into public, are you going to have people maybe making you feel less than comfortable to feed your baby? And then when you return to work, are you going to have the facilities in place for that? We really don't make it easy for women to breastfeed in America.
No.
And because of racial disparities that exist, it hurts Black women even more. But it's not easy for anyone, really.
Right. So would you say that your audience, so it sounds like with that perspective and that goal, your
Mhm.
audience you're hoping would be mothers who are thinking about
It's it's
pregnancy and
it's
their
primarily,
families?
yeah, the target audience is Black mothers,
Okay.
but then the secondary audience are all the people who will be her support system.
Hmm.
Because a lot of times, the women that I've interviewed when I was doing the web series, they were all gung ho about breastfeeding. They were aware of the challenges and they were aware of the benefits, but it was their family members or maybe their partners who didn't quite know how to be helpful and didn't know that certain comments or certain behaviors were actually counter to that. So the goal is to educate the community so that
Right.
they can better support the mom's choice, because it's not so much to convince moms to breastfeed, it's more mothers who want to breastfeed knowing what they're going to get into, and also making sure that their support systems understand, like, this is what helpful behavior looks like and this is what counterproductive behavior looks like,
Hmm.
but in a way that the way that I'm approaching it is I want it to be less talking heads, and more focused on just people's stories,
Yeah.
which is why I'm following a mother who's a first time mom. And we see her talk about her ambitions to breastfeed and then what really happens when real life hits. And then I'm following a midwife currently, just to show how that birthing experience in that birthing world. And I'm right now in negotiations because I want to follow a woman who works for a wake office,
Yes.
but you have to get special permissions to be there. So I'm working on that, and fingers crossed that we'll get the green light so we can film what that interaction is like. And because I see these, there's the mother, but then there's also the person who's there to coach or their champion, and I almost see it like a coach with a team of athletes, and he wants them all to make it. But there are different challenges that come up with terms of their performance, and you hope that they all stay with the program. But sometimes people fall off the program, and uh, I wanted to show the perspective of a service provider
Right.
as
Right.
well.
Right. So a lot of what you're talking about, a lot of these issues pertain to the average American woman, not just African American
Yes.
women. But what about it? So many of us who are on the sidelines, like me, I'm white, I'm older. I've I've I sat on the infant mortality committee for Wisconsin when they had a special committee put together trying to figure out how can we reduce the higher infant mortality rates among African American women, and I was on there as like, we need to increase breastfeeding rates. And so, what about this? What will help us in this movie to understand how we can support African American women in terms of their breastfeeding goals?
That's a really interesting question, and it's always tough to answer because it's not some simple magic button. because part of the reason you see these gaps, they're very much about race. It's about implicit bias that the woman might experience in the healthcare setting.
Hmm.
It might be internalized racism that her own community has adopted about Black women's bodies,
Hmm.
and her own personal feelings about her body, and that sort of thing. And then there's also the issue in terms of occupational diversity.
Hmm.
When a woman goes to get counseling from a lactation consultant or peer educator, does that woman understand her experience? Is
Right.
she going to be able to help her in a way that is equitable? Or
Right.
is she going to face implicit bias on the part of the healthcare provider? Or is she going to feel comfortable enough to share what's going on in her life with this provider without feeling like she's going to be judged? And so, another topic that I wanted to address in the film is the kind of how the disparity in breastfeeding almost runs parallel to the disparity in Black women who are equipped to provide lactation consulting services.
Right.
And so we talk a little bit about international board certified lactation consultants, and the steep curve to get that credential,
Right.
and how it kind of leaves out a certain demographic. Um, because that definitely because if you're experiencing bias, then the solution for that is that you have someone who can relate to you better.
Right.
But if there are fewer of those individuals available in your community, then what do you do?
Right.
Um, and it's a very tricky subject, because anyone who works in the healthcare field, they feel like they're giving the best care and that they're doing the best they can. And to say that one person maybe can serve a patient better than another, it gets a little tricky. It's a very sensitive subject to broach, but
Yeah. Yeah.
there's definitely an issue there.
Yeah. No, there's an absolute issue, absolutely an issue, and I think that that I think is a huge barrier in supporting women in this country is that we don't have much diversity in IBCLCs. We have very few Black IBCLCs. We have very few Latinas
Yep.
and Hmong and Asian IBCLCs. So I see that as a huge issue. You need to be able to relate to the person who's counseling you for sure, and the
Yes.
counselor needs to understand the population. Um,
Hmm.
and
And it's not for a lack of desire.
right,
That's the interesting thing. There are a
right.
lot of women who would like to get that credential, but maybe can't afford the new college level course curriculum that's now required, maybe can't afford the test, or
Hmm.
maybe can't find a mentor who's willing to get them their hours.
Absolutely. Yeah.
So,
Yeah. And unfortunately, and I think the whole field of lactation is kind of marginalized in that way financially because so many women that do lactation consulting find that it's difficult for them to make the living that they need, a living wage, because visits do take a very long time. And it's difficult to charge a lot of money for those visits. And
oh,
so,
absolutely. Yep.
so what they end up doing sometimes is charging money for people who need mentoring. And so I've heard some people complain that they just kind of threw in the hat. Like, I just can't get trained. I can't afford this. I can't afford going through this whole process of not only taking the classes and then preparing for the exam, but then having to pay a mentor, and then not knowing what your income is going to be. If you're not an
Hmm.
RN IBCLC, then your job prospects are more limited. So it's definitely there's definitely a bias towards people who have some money to begin with, who have the ability to afford sort of a more elite education. Definitely.
That's interesting. I hadn't heard that they were charging people for mentorship opportunities. I have to look into that. That's definitely unfortunate to hear.
Some do. I think some private lactation consultants. I mean, I'm definitely not speaking for all lactation consultants.
No, of course.
Yeah,
Yeah.
but I've definitely heard that complaint from some women who are trying to become IBCLCs who just cannot find a mentor who won't charge them a significant amount of money.
Wow. But the women who I've talked to, their issue was that because there's a scarcity mentality, because as you said, people feel like maybe there's a small population of women who are willing to pay for these services. And so if I train someone else, are they going to become my competition?
There's that
Um,
too. Yeah.
there's some of that there. Yeah, I could go on.
Yes, yes. There is that. That's an issue for sure. Yeah. Um, so I wanted to say too that one of the things that many of us talk about that were a big topic that many of us are fighting right now in states and hospitals is a whole issue about birth control and about long-acting reversible contraception, the progesterone IUDs, the progesterone shots, and the progesterone implants that are being given to women, a lot of times poor black women, after they give birth, because by golly that woman should not have another baby. And there's this paternalistic attitude about
Hmm.
this population. A teen mother comes in, she's 19, she just had her second child, she needs to have Nexplanon so she doesn't have another child for 3 years or whatever. And so that has such a huge impact on lactation because there's a subset of women who receive those progesterones early who then don't lactate. They don't make enough milk. And so then they end up premature weaning, and then those babies, or those mothers and babies, are both at risk for the typical health risks of not lactating or not receiving breast milk. And it's very difficult to have that conversation with physicians, hospitals, uh, policy people, like who make decisions like for state Medicaid medical assistance benefits.
Hmm.
It's very difficult to have that conversation because the evidence for the effect of progesterone in lactation is not fantastic, and so people just assume that it doesn't really play an important role in reducing the ability to fully lactate. Those of us in breastfeeding medicine really know that it affects women quite strongly, but it's variable and it's hard for us to pinpoint who it affects. But I feel like that's an injustice that's done to more likely to African American women and other women of color, and certainly women who are poor, as opposed to women who are more educated, higher socioeconomic status, who generally will not even consider birth control until at least 6 weeks postpartum.
And I'm so glad that you brought that up. When I say implicit bias, that's my very polite way of referencing that whole
Yeah,
area that whole issue that you just summarized very, very well. Um, yes, I don't even know. I'm trying to think of where to begin with that. Breastfeeding, the gap in breastfeeding affects Black women, across education and income level, and it's because, just like you mentioned, they'll see the 19-year-old and go, well, she shouldn't be having any more babies. Let's put her on birth control. They make that assumption about a woman who's in her 30s and comes in with their husband.
right,
They'll look at her and assume that's your baby's daddy, you're unmarried, and you must be a teenager.
right,
Because they're projecting this
right,
idea of what a Black mother must look like, and so it's not appropriate behavior. It's not appropriate solution or way to treat her if she was a teen mom. But then they're extrapolating that across any Black woman who walks in the door.
right,
There's so many anecdotes of women who came with their husband, and the nurse it ignored him or said, "Oh, is this the baby daddy?" It's like, really? And
right,
so
yeah,
that does happen.
right.
um, uh,
Eh,
One of the women who I really want to get in the film, so maybe if she ever hears that, maybe this will get her attention. Dorothy Roberts wrote a book called Killing the Black Body that
Oh,
really explores that whole legacy of um, paternalism towards Black women and their reproductive health, uh, across from starting from slavery,
hmm,
until through the 90s, when a woman would get, I think the government would offer free contraceptive implants, but you couldn't get them removed.
oh,
There is
wow,
no money to, so if you started experiencing symptoms,
wow,
there was no money to remove it. And so it was almost like it's forced temporary sterilization. Yeah, and so there's a lot there. I'm definitely interested though in terms of the how that affects lactation.
right,
This early use of contraceptives immediately after having given birth.
yeah.
That's an area that I'm not as familiar with, and you got me excited when you mentioned that. I was like, ah.
Yeah, that's, I think it's a good thing to draw in because it definitely impacts breastfeeding. And I think the other thing is that there's this belief that, well, black women don't breastfeed. And I've heard this
Oh,
from other African American women who are IBCLCs. They start out with just the statement of like, people think that blacks don't breastfeed. Of course black women breastfeed.
is 60% of Black women breastfeed.
Right,
We're just
exactly.
breastfeeding at lower rates.
Right, exactly. And so, so that I feel like that whole birth control, that paternalistic decision on birth control is like, why would I even talk to her about breastfeeding? Because I know she's not going to, and she's not going to.
Yep.
And it's that whole attitude of like, well, she's not going to be a responsible mother, and the grandmother's going to be raising this kid anyway, and so the grandmother's not going to be able to breastfeed this baby, so she's just going to go out and get pregnant again. I mean, that kind of seems like this, this attitude or this belief that is obviously unjust and yeah.
As
So
you talk, I realize when I say implicit bias, I am selling the issue very short because I'm because those are exactly what I'm talking about when I
right.
say that, but that's like my like polite shorthand for it. But you've broken the issue down very well. Like it's exactly that. They assume that she's not going to breastfeed. I've even had anecdotes where a woman says she wants to breastfeed and the nurse will tell her, but black women don't breastfeed, so you don't want to breastfeed, even though the mother is in the room with the nurse saying, I would like to breastfeed. Can you show me
Wow.
how?
Unbelievable.
And
Unbelievable. Yeah.
I think it has to do a little bit of, with American health literacy. When people read statistics, they don't quite interpret them the correct way,
Huh.
and
Right.
it becomes like a blanket generalization that's not quite what the statistic was saying.
Right. Right.
So
If
that's
it, because the
that.
rates are lower, it doesn't mean that they don't breastfeed, is what you're saying.
Yes,
Yeah. Right.
yes. People
Exactly.
interpret, and next thing you know, they repeat it, and it becomes a thing, and it's not at all bearing any resemblance to the initial study.
Right. Right. So where are you at with your movie? Like, how far along are you? What are your plans?
We are in, I would say, the first third stage of it, because there are three women who I'd like to follow. My goal is to follow each of them for 6 months, just to
Hmm.
get their story and then piece them together with commentary from experts and other moms. And so I finished filming the mom who gave birth for the first time, and we followed her for 6 months from her prenatal visits to when she returned to work to just see what her experience was like and how she was able to meet her goals. I'm in the process right now of filming our midwife, who's actually quite well known, Rashad Tahani Lawler, and we're following the trajectory of her story because she actually opened a community birthing center, and there was an issue with getting the community to value the service.
Wow.
Um,
Wow.
and so that's definitely a factor that I wanted to address because there are women who have had experiences with birthing or with breastfeeding, and they want to make that their full-time occupation, and they commit themselves to helping moms, and then people aren't quite aware of the value of what service it is that they're providing. So I want to talk about that a little bit. And as I mentioned, for the third woman who had her own personal challenges with breastfeeding and became a peer counselor at a WIC office, she really wants to become an IBCLC, and she's taking classes. She's been taking classes for several years, and I really want to follow that process because that talks about the barrier to entry.
Yeah.
So, I've covered the bases, the mom's experience, healthcare provider's experience, and the woman who wants to become a provider to increase the level of diversity, but the challenges she meets with that. And so, because I wanted to make the film more than just, well, the benefits of breastfeeding are this.
Right.
Um,
Right.
I wanted to talk about that whole community.
Right, right. Yeah, I think yeah, those of us who are people who are listening definitely understand that saying that breastfeeding is beneficial. It's like saying have some broccoli with your sandwich. It's just
It's
doesn't.
like,
Yeah,
it's like,
exactly.
but then what?
Right,
You made the decision to breastfeed, but then what?
right.
And the Black breastfeeding community is quite robust. They're very passionate. There are a lot of grassroots organizations that have established themselves in different states and are really pushing the message and providing that support that was part of the problem. That was part of the gap that we were seeing is that if you're the first in your family to breastfeed for 2 generations, who's going to help you do it?
Yeah,
Who's going to talk you off that ledge when your milk's not coming in for 48 hours? Who's going to explain to you that that's normal?
exactly,
um, and
exactly.
yes, and so it's a beautiful thing. It, it's like civil rights movement almost for me to watch these women who are so dedicated and they're creating their own solutions
Yeah.
um, at the community level. I just think it's so remarkable, and definitely is something is analogous. It's analogous to a lot of other issues we're seeing in society in America, how they're fixing it themselves as opposed to
Right.
waiting for a top-down approach.
Exactly.
Um,
Yeah.
so I have a lot of ambitions in this film, but I think we can tell the story without confusing the audience or
Yeah.
overwhelming them.
Oh, I don't think anything here is confusing, but I think it'll be great to highlight some of those local supporters because we have seen
Yes.
that in some areas in Wisconsin too, and it's super sweet. And we're talking about really small groups, like 10 to 12,
Hmm.
moms or other women who come together and just really surround and provide that safety net for these vulnerable individual women. So it's pretty cool. Yeah.
Yes, it's very low tech, but it makes such a big difference.
Yeah.
Just talking.
Absolutely. Exactly. Just
So-
talking and being there, bringing a warm meal, whatever it is, definitely makes a big difference. Yeah. Well, great. Well, I'm super excited to see what happens with the movie. Do you want to share any contact information in case people want to donate or people want to, talk more about it in their own circles or whatever? Any other way to support what you're doing?
Absolutely. Thank you for asking. I have a website, which we're in the process of updating. Um, it's called Chocolate Milk Doc. So chocolatemilkdoc.com. And then we're also on Facebook, Twitter, and Instagram. If you Google any one of those social media platforms and the word Chocolate Milk Doc, that's our handle for most of those platforms. Although for the Twitter account, the milk doesn't have an I in it, so it gets a little confusing.
Okay.
But we're up there and we post and we share a lot of content from our nonprofit partners who are focused on breastfeeding issues. And so we share content, we share video interviews that we've had with different mothers. So we're definitely online and available. And yes, please definitely check us out on the
Great.
web.
Well, thank you so much for talking to me today. This is a great interview. I'm really
Oh
excited to see
gosh,
your movie.
thank you so much, and thank you so much for working with the schedule. I'm so glad that we finally got to talk.
Absolutely. So I will talk to you soon. Okay,
Likewise,
take
yes, I
care.
look forward to it.
Yeah.
Thank you, Anne.
Bye.
Bye bye.
For questions regarding this podcast, contact us through themilkmob.org. We have other educational projects going on there, such as the Clinical Question of the Week and our Outpatient Breastfeeding Champion programs. If you want to see what we look like, check out our Facebook page, where you can also share comments and questions with your co-listeners. To learn more about the Academy of Breastfeeding Medicine, please visit www.bfmed.org. Thanks for listening. We'll be back with you in a few weeks.